Hi, I'm your friendly dental student.
And today we'll be talking about oral health for 0 to 3-year-olds. Before we begin, I first want to direct you to the American Dental Association, which is like the #1 organization in US for dentistry, and the American Academy of Pediatrics, which is like the #1 organization in the US for the dental specialty of pediatrics. You can easily find these resources with a quick search. The first topic for today is, this is a little bit like I draw and you have to guess. Did you get it? It's pregnant moms. The ADA recommends that pregnant women continue to get dental care throughout pregnancy. This includes preventative and restorative care, including local anesthetics, x-rays, dental work. All of that has been given an okay by the American Dental Association. The reason that this is important is, first, for the mom, but also second, for the baby. Bacteria that can cause cavities can spread from mom to baby. So, since healthy oral hygiene is a lifestyle, it's good for the mom to build that habit now and learn how to clean her mouth and get rid of or keep the levels of bad bacteria low. Second, we have we have breastfeeding. The American Academy of Pediatrics recommends breastfeeding for babies until 6 months. Breastfeeding is good for bonding, for sharing antibodies from the mom to the baby. It's also good for fewer diseases for the baby, decreased risk of sudden infant death syndrome, etc. Around this time, the baby will have their first baby tooth. So up to 12 months reduces caries or cavities. But after 12 months, continued breastfeeding increases the risk of caries. We'll put a little unsure face right there. There are mainly two differences. First, the baby didn't have teeth before, and second, the baby may be getting carbs from other sources now. So after the first teeth, we recommend that parents breastfeed on a schedule rather than on demand and not at night. If you see an ulcer on the bottom of the tongue of your baby, like this, it's probably because of irritation from their baby tooth, because their bottom 2 teeth will come in first. If that's the case, you can go to your dentist and she or he may smooth the edge of the tooth with a burr or add composite so that the edge is smooth. And they'll only probably extract the tooth if it's mobile and there's a risk of being aspirated or swallowed by your baby. The third topic is bottle feeding and sippy cups. Bottle feeding is fine until 6 months. But by the time the baby is able to sit up, it's good to transition to sippy cups. And definitely, it is recommended by 1 year. There are lots of drinks that the babies may have, like milk, water, juice. But among these three, milk, we already talked about, is good under certain circumstances, like not having them going to sleep with milk. And water is always good. Water is always good. But for juice, the American Academy of Pediatrics does not recommend fruit juice for children under 1 year. The reason is that it doesn't add to a healthy diet and only increases the risk of cavities. Also, juice adds an excessive amount of calories to their daily intake, and the children are likely to become picky eaters or anemic. This is like their baby tooth and coming out of their gums. These recommendations are so that they don't get cavities, and you'll first start to notice it near the gums. Lastly, the topic is juice. Like we mentioned before, the American Academy of Pediatrics recommends no fruit juice for children under 1 year. For children who are 1 to 3 years old, the maximum amount daily that is recommended is 4 ounces. I kind of Googled to try to figure out how much is 4 ounces, and I found that for a lot of the companies, even their smallest juice box was a little over 4 ounces, which would be a little bit more than their daily intake. If we are giving our children juices, it's better to give them 100% fruit juice over fruit cocktails, and it's better to give them the fruit itself over juices. So remember, the main point is that we want to reduce sweetened drinks to meal times and short periods. That's all for today, and I hope that this helped. Bye!